the shift in clinical practice was changing from taking care of patients to productivity. And the more I was being pushed to be more productive rather than, concentrate on quality of healthcare, I became dissatisfied, with my work.
Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, and challenge the status quo and explore what it really means to thrive. So let's get into it. I'm Dr. Santoshi Balakota.
Dr. Shalom, welcome.
And today we have a very special guest. We have Dr. Michelle Boudreau. She's a fellowship trained neurologist and clinical neurophysiologist. She excels in both clinical and non clinical work. In addition to her clinical practice, she also does medical legal consulting and offers her expertise to plaintiffs and defense counsels. She's also an expert in disability work and independent medical work as well. She's an independent medical expert, so we're really excited to speak with Dr. Boudreau because I think a lot of the times when we are in clinical medicine, we, for whatever reason, want to try to get out of it or try to diversify at least, but we don't know how. And she's actually doing it. Is there anything more about yourself that you wanted to share with the audience?
Thank you so much for having me. I'm very excited to be here. I think you covered my background pretty well. I don't have anything to add.
Let me start off with asking you kind of what got you into exploring non clinical work? Do you mind giving us a little background of your medical journey? And at what point did you say, hey, I wonder if there's something else I could be doing in addition to clinical practice?
So I did my medical school training at PCOM, and then I completed my internship at St. Vincent's Hospital in Worcester. And then my neurology residency was at University of Connecticut. And that's actually where I was first introduced to non-clinical work. I had an attending physician that I worked with who mentored me, and he was involved in the medical legal realm. And he served as an expert witness, and I believe he also did independent medical exams. So he started talking to me a little bit about that during my training. And eventually, I moved on to fellowship at University at Buffalo, and then after that, I started working at local hospitals, and that went on for about 4 years. At first, I worked at um, Hartford Healthcare, Wyndham Hospital, and then after a couple years there, I moved on to Trinity Health of New England. And it was during my time at Trinity when I decided I wanted to look for more options. There was a huge burnout factor. I felt that the shift in clinical practice was changing from taking care of patients to productivity. And the more I was being pushed to be more productive rather than, concentrate on quality of healthcare, I became dissatisfied, with my work. So in about 2017, I started looking into other options, and I actually had received a pamphlet through the mail about non-clinical work for physicians, and I decided to look into that a little bit more. I went to a conference related to that, and decided that it was time to make a shift in my work practice. I wasn't quite ready to give up clinical medicine, but I came up with kind of a model where I would do part-time clinical and then part-time non-clinical.
And so, do you think being a woman in medicine played a role in some of your burnout? Did you find any challenges in terms of, being a woman and like other toxicities that came your way in your prior position?
Yes, I definitely feel like being a woman in medicine contributed significantly to my burnout. I noticed in my last local job that even though the physicians within my practice were excellent. They treated me very well. The staff members in my practice, as well as physicians outside my practice and their staff members, seem to have a bias. And I felt that a lot of it was due to my gender, because they would treat the female physicians differently than the male physicians. And it was almost like this lack of respect and boundaries. And when I would try to, advocate for myself in a professional manner, obviously, there was often backlash on me, because of that. And I noticed that this was not happening with my male counterparts. And because of that, there was certain administrative duties that were placed upon me that weren't placed upon the men in my group, and it significantly led to burnout because I was not only doing my job as a clinician treating patients, but I also had to do some administrative secretarial duties that the men in the practice did not have to do.
That's really unfortunate. And we see that in a lot of jobs, in a lot of clinical jobs, that there is a huge difference in how men versus women are treated. When women advocate for themselves, they come across as aggressive, or advocate for their patients, even, or safety concerns, or things like that. They are seen as lazy, not a team player, non collaborative. But on the other hand, if a man says the same thing, it's corrupt. It needs to change. So I totally agree with that, and I'm sure Santosh, you have that experience as well. We all have this experience.
Yeah, definitely. I mean, I have. I think it's a shared pressure point for all of us. So at this point, Michelle, we were talking about this a little offline. You're also still practicing clinically, is that correct?
Yes, I'm still practicing part time.
Got it. What's the requirement? Because I didn't even know this, and Michelle and I didn't. But what is the requirement for most of these positions? Like, I know you can't leave clinical medicine fully, but do they expect like 20%, 50%? How much time should you be still investing in clinical work?
It depends on the area of non-clinical work that you're looking at, but kind of as a general rule, I use part-time clinical work as a general rule as far as meeting the requirements. Some places like some disability review companies, require a certain amount of hours per week that you have to devote to clinical work. But typically, if you work an average of 20 hours per week in clinical medicine, you would qualify to perform the disability file reviews, the independent medical exams, and the expert witness work. Like I said, there is some fluctuation in that depending on the attorney and the company. But that's my golden rule, and since I've been doing that, I've never had anybody, disqualify me from this type of work.
Can you elaborate more on the type of non-clinical work that you do? Basically, walk us through a typical day or a week of non-clinical work.
Sure. So I tend to develop my weekly plan of non-clinical work based on what I'm doing clinically. So, obviously, the days where I'm seeing patients clinically, my time is limited that I can spend on my non-clinical work, and each week that varies. Some weeks, I may be seeing patients more than other weeks, but when I'm devoting time to my non-clinical work, um, usually on the weekend, usually on Sunday, I look over my week. I see where I can place where I have you know chunks of time where I can do my non-clinical work. And then I look at what I have to get done for that week. Whether I have, this amount of disability reviews, or if I'm working on an expert witness case and I'm either reviewing the files for it or I'm working on the report for it. And I kind of organize it that way. And it does allow for a lot of flexibility, because, I I can kind of pick and choose with what I have available for that week, as time slots to put these things in. And that allows me to kind of organize my schedule so that I also have, time for like a work life balance where I have time for family obligations, and time for self-care for myself. And it's just a lot of flexibility during the week, and I really enjoy that because I have a lot more autonomy and I'm able to really organize my schedule, the way I want it.
And so tell us how you kind of got started in each one. Like, I know we mentioned disability reviews. There's a lot of companies that do disability reviews. I do disability reviews for a few companies myself. Did you initially just reach out, or did you like join an organization and then asked, or how did that work?
So when I was looking into non-clinical options for myself, I actually attended a conference that was organized by Seek, and that's spelled SEAK. And every year in October, they have a non-clinical conference. And so I attended that. And during that conference, they almost have a job fair where you can sign up for certain companies or certain type of work. And at that job fair, I got in contact with a couple of companies that worked as kind of third party, in between the insurance companies and myself. Um, and they distributed, disability file reviews, to physicians. And the whole thought process behind that was that, if I didn't work for the insurance company, then I would be able to give an unbiased view. I wouldn't have any ties to the insurance company. So I ended up signing up for some of those companies, and then I also the Seek company also has directories where you can put your name in, if you're interested in disability reviews, and then they have a separate one for IMEs, and then another one for expert witness work. So I started putting my name in those directories, and then the companies or the attorneys would reach out to me, once they saw my listing, and that's often how I got a lot of my work.
Is that how you got your expert witness and IME work as well, through Seek, or did you advertise yourself in other ways?
Eventually, I did start advertising myself on some free online directories. I'm also in the ALM expert directory. That tends to deal with more personal injury cases. Um, so even though I started with the Seek directories, over a few years after that, I started accumulating other ways. I also use LinkedIn. I get a lot of my work over the last several years from LinkedIn. Um, I just advertise myself on LinkedIn as being interested in these non-clinical areas, and I'll get messages pretty frequently from paralegals or attorneys, or even once in a while, disability review companies that are looking to add to their panel.
What aspect of your non-clinical work do you find most fulfilling for you?
So, what I really liked about this area of non-clinical work is that I'm actually helping a lot of people. I'm just doing it in a different way than I do in my clinical practice. And I'm doing that by giving an unbiased view of whatever case I'm assigned. So whether it's restrictions or limitations, uh, from a disability perspective, or whether I'm providing an opinion regarding causation, negligence, or standard of care, in a medical legal case. Either way, you know, basically working for the justice system. So I'm working on the side of truth. Um, and that's what's great about this is that, I'm with disability cases, I'm helping, um, really help delineate what a claimant can or can't do, due to their neurological condition. And then, the company in turn takes that and they translate that into whether that means disability or not, or partial disability. Um, and, sometimes these people would normally not be approved for any form of disability. And if I find that they have restrictions and limitations, it helps them get that approval. And then on the flip side, if I find that there are no restrictions and limitations, that's actually a positive as well, because studies, have shown that being out of the workforce is very detrimental to people's mental health. So it can show that these people, are capable of working and leading fulfilling lives, and can, kind of give that push to get them back into the workforce. Um, and ultimately, it helps with their mental health as well. And then as far as the medical legal cases, again, I'm working for justice. Whether my opinion is in favor or not in favor of whoever retains me, it helps them, because if it's in favor, then I can help with that case and get the justice that's deserved. If my opinion is not in their favor, it's actually helpful to the attorneys as well, because then they know, hey, look, it's not worth pursuing this. It's not worth going through the whole process of the legal system if there really isn't a justified case here.
And you mentioned Seek already, but are there any other resources or courses that you found helpful, like any books or podcasts, to kind of help you get started?
A lot of what I did, a lot of the courses I took, were through Seek. Chris Brigham does a lot with IMEs. And so I've taken some courses through him as well. And he also does a lot of work with the AMA guides for disability. And his courses really help um, to train you to come up with accurate disability ratings, which a lot of times is important in the IME world.
Does Seek also help you like kind of set your rates?
Yes. Seek, what's really nice is every year they come out with a survey, and, people obviously take part in the survey, and then they compile that. And you're able to look at what the common rates are for each specialty, and look at like kind of the ranges for the rates, whether there's retainers or not for that specialty. And it definitely helps you, helps guide you, as far as what fee you should be charging.
Is this mainly a fee for service, or there's a monthly fee or monthly salary, stipend? How is the pay model usually?
So typically, for expert witness work as well as the disability reviews, most of them are per hour. So you charge a certain amount per hour. Sometimes I've seen with the disability reviews or utilization reviews where they'll they'll offer you just a lump sum for it. But I really advocate for the hourly fee, because this way you're getting compensated, appropriately for your time. If you agree to a flat fee, then it's, if you get 100 pages of records to review, you're getting paid the same than if you get 1,000 pages, and that's not, really fair in my eyes. So I try to do the hourly rate, for most of my work. And then with the independent medical exams, a lot of people will charge just a flat fee for that. What I tend to do is I will calculate how long a typical IME takes me, including the report. And then I say this includes this amount of records, and then charge that flat fee. And then if there's any additional pages or number of records beyond what that includes, then I stipulate that I charge extra for that.
This might be a question just from me personally. So I do depositions and expert witness and some IME stuff myself. And I've gotten better at speaking with lawyers, especially when you're being deposed. Do you have any advice on how to get better of that? Because I think as physicians and in general, I think when you think about, oh, law, like I don't want to deal with lawyers, like it's too scary for me. But it sounds like you've done it for long enough where now it's comfortable.
Yeah, so I've done quite a bit of training for depositions. Again, a lot of it was through Seek. They have a separate course for it. They have an in-person course, which I attended. They also have a course on CD that, or they used to. I'm not sure if they still do, but I got that as well. But I also get one-to-one training. I haven't done it recently because I've gotten so used to doing depositions at this point that I don't need it. But for my first few depositions, I got one-to-one training with one of the Sikh attorneys, and I found that extremely helpful because she would, whatever case it was, she would look over my report, and then we would spend 2 to 3 hours where she was just drilling me on things that. She would pick out things that they were likely to pick out and drill on me, about. And I found that really helpful because a lot of times I would get into that deposition and sure enough, those attorneys would pick out those things, and I already knew how to answer.
Any skills that you think that physicians should have in order to go to these type of non-clinical work? Any surprising skills that you developed along the way?
Yeah, because it's almost like you have to shift your mindset when you go from clinical to non-clinical work. Because as a physician treating patients, your job is to diagnose the patient accurately, treat them, and then also, there's a sense of this physician patient relationship where you believe everything that they tell you. um with non-clinical work, it's almost like you're taking yourself out of that relationship and looking at the case as a whole. And it's not about advocating for a patient at this point. It's about figuring out, whatever the question is. Is the question, do they have restrictions and limitations related to their daily activities? If that's the question, then you have to, look at parts of the file that will give you clues as to, what is their functional capacity. If it's a medical legal case where, you're trying to figure out, was the standard of care met, or did a certain act by a physician, was it negligent, and did it cause the injury that the person suffered? And again, you're looking at the totality of the evidence, and so you're really trying to pick out these key things in the record, or on the scans, that help you answer those questions. And so it's almost like detective work. I feel like I'm being a detective. I'm trying to, look for any inconsistencies between different providers' notes. A lot of times when you're treating a patient, you're just, worried about, what's going on in that setting with them. But in the medical legal realm, it's important to look, okay, well, what's going on in all the settings? Even though I'm looking at it from a neurological perspective, it actually may be important to know what happened at the visit, you know, the day before with, the physiatrist, or whoever it may be. So a lot of it seems to me like picking out these details to answer the specific question that you're asked, and just finding those inconsistencies, when they exist, or consistencies, seeing if there's consistency across the record, kind of like detective work in the medical field.
Okay, we're going to pause here for this week, but don't go too far. We'll be back for part 2 next week, and we'll tune into the rest of the conversation. Thank you.